And welcome to the Dr. Bob Show. Do you enjoy having a glass of wine with dinner, or maybe 2 glasses of wine? Do you enjoy having a beer on the weekend? Have you ever been buzzed by drinking alcohol? Has alcohol ever interfered with your lifestyle? Have you ever had too much alcohol on one occasion, or maybe more than one occasion? Is alcohol interfering with your family life and with your social life? We'll be spending most of this show talking about that. My guest is Dr. Chapman Sledge. Dr. Sledge is board certified in addiction medicine, and he'll be answering our questions. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about a heart stress test, who needs them, and polyps in the nose. Could they be bothering your lungs? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Chappie Sledge, Dr. Chapman Sledge, board certified in addiction medicine. Chappie, welcome to the Dr. Bob Show.
Thank you so much. It's great to be here.
How much a problem is alcohol in our society?
Alcohol is a huge problem. About a third of people in our society don't drink at all. About a third of the people in our society drink with minimal risk. And about a third of people are at risk for having alcohol problems, and as high as 10% of our society is alcoholic.
That's very, very high. Do people recognize that they've got a problem most of the time, or does their family recognize it?
Most of the time, the person with the disease of alcoholism is the last to know. Denial is a hallmark of the disease, and denial is a phenomenon, a distortion in thinking that tells the person that they don't have a problem, that they're not hurting anybody but themselves, that it's really not that bad. Often the family has an awareness, but families can experience denial as well, and sometimes it's the legal system, sometimes it's the boss, sometimes it's friends that can provide the motivation for treatment.
So it gets pretty widespread as far as the envelope of who says, I think you've got some trouble, you need help.
Absolutely, and the impact of the disease, I think one of the biggest myths of the alcoholic is that they're not hurting anyone but themselves. And if you look at the ripples of the damage, it affects families, it affects friends, it affects jobs, it affects productivity, and it affects our society with legal, incarceration, social systems, etc.
So really the damage that's done socially to the family, physically to the family, and financially to the family is very, very significant.
Absolutely.
So how do we tell the person that alcohol is interfering with their life and their family's life? How do we come to that decision?
Typically, it's difficult for a family to have the insight that the drinking has become problematic, and often they do experience their own denial. But when they do come to the realization, it's a challenge to motivate the alcoholic. They're going to be resistant often to any intervention, to any effort to get the person to engage in treatment. And there are professionals that are trained in the process of intervention to assist the family, to provide motivation for the person. They may not have much internal motivation to seek treatment. And the trick with an intervention is to provide external motivation for that to happen.
When you say external motivation, what do you mean?
External motivation in the form of the family setting boundaries. We're not going to allow this behavior to continue, and if you don't seek help, this is what the consequences will be. Motivation may also come from employers with mandates, and it often comes from the legal system as part of a sentencing may mandate treatment. And denial is not peculiar to the disease of addiction. We see denial often in other medical illness, and if you think of somebody showing up in the emergency room with chest pain and, oh, it's the enchilada last night, for that person to accept treatment of their heart attack, they've got to accept that it's necessary. And it's pretty easy to confront denial with an EKG and cardiac enzymes. It's much more of a challenge with alcoholism.
How much alcohol does it take to become an alcoholic? Can you actually have 1 drink a day and become an alcoholic, or does it take 22 drinks a day, or is there volume associated with it necessarily?
People tend to think of how much and how often as the cause of alcoholism, and really it's not so much how much and how often, it's the timing and it's the susceptibility of the individual. The National Institute of Alcoholism and Alcohol Abuse has established guidelines for at-risk drinking. For an adult male, for example, no more than 14 drinks through the course of a week and no more than 5 drinks in any single day. For a woman, it would be 7 drinks over the course of a week and no more than 4 drinks in any single day. Anything beyond either the daily limit or the weekly limit would indicate a risk for developing an alcohol use problem. But alcoholism is not really based on how much and how often. If somebody's drinking a 6-pack a day, that really doesn't tell me much. What I need to know is what kind of problems it's causing. Alcoholism is a complex disease, and if you think of how a molecule in the brain can manifest with self-destructive behavior, the complexities are incredible. Alcoholism is a disease that's manifest by a loss of control over the use of alcohol. Very simply, it can involve physical dependence with tolerance. It takes more to produce the same effect, or drinking the same amount produces less of an effect. And it can involve withdrawal. Abrupt discontinuation of alcohol use may produce some withdrawal symptoms, but the hallmark of the disease is a loss of control, and not everybody who drinks is going to experience that crossing the threshold from problem drinking into alcoholism.
Is that genetic then? Let's say we've got 10 people and they're all drinking a 6-pack a day, and 2 of those are going to become dependent on alcohol, and what happens to the other 8, or what percent, or is that a correct analogy?
That's not a bad analogy, and certain individuals have a genetic susceptibility. If there is an alcoholic parent, the likelihood of the offspring being alcoholic is greatly increased. There are various, and it's not so simple as the alcohol gene. In 1990, a paper was published in the Journal of the American Medical Association that identified the alcohol gene, and I got so excited. Yeah. Having 3 children at home, let's go get our fingers stuck, girls, and see who's got this thing. And what we know now, there are multiple genetic factors on multiple genes. There are over 80 different factors involved that can lend either a protection from developing the disease of alcoholism or a prediction for developing the disease of alcoholism. So there are various genetic factors, and also behavioral factors are huge. For example, the earlier the onset of alcohol use, the more likely that person is to develop dependence. If you look at kids that...
So go back to that statement. So if you start alcohol ingestion, just drinking some alcohol at age 12 or 13 or 14 or 15, it's a greater chance of becoming an alcoholic than if you start at age 20, is that?
Absolutely. Absolutely. I don't know who came up with 21 as the age of consent, but it was brilliant. If you look at kids that expose their brains to alcohol prior to the age of 15, there's about a 5-fold increase in alcoholism as opposed to kids who waited until after the age of 21. For parents, every day that you can delay that exposure, every day you can prevent your child from taking that first drink, their risk of developing alcoholism actually goes down a little bit.
When people are true alcoholics, and maybe they don't know it, can they stop drinking, or is it a true addiction that they cannot stop drinking, or if they do, they go into some problems?
Well, certainly there are people that have a very significant physical dependence, and it is not safe for them to just stop drinking. In fact, they're not going to be able to tolerate very well just not drinking. If that's imposed upon them as the doors of the jail slam shut, they might be in trouble. A very significant withdrawal syndrome can develop, and it can be life-threatening. Delirium tremens is an extreme form of alcohol withdrawal, and it has a very significant mortality rate, even when it's treated aggressively. So alcoholism can be manifest by pretty severe physical dependence, but it doesn't have to be. It's interesting that certain people are binge alcoholics, and they may drink episodically and then not take a drink for weeks or sometimes months.
Are they alcoholics if
Absolutely.
they're binge alcoholics?
Absolutely. It's absolutely. If they're not able to consistently moderate or control their use of alcohol, they're alcoholic.
If the family identifies it and intervention is needed, is it frequently intervention successful?
Well, the success of an intervention is getting the person into treatment.
And that's what we're going to be talking about when we come back. We're going to talk about How do you get the person who's in deep trouble with alcohol to go in for treatment, and what's that treatment like? We're talking with Bill Lee, who's professional, if I might say, at intervention and helping people that have substance abuse. Bill, tell me about Al-Anon. How do you like Al-Anon?
I love Al-Anon. Every time I meet with a family about an intervention for their chemically dependent person, I recommend that they get involved in Al-Anon. It's the #1 thing they can do to stay sane.
So that's for family members?
It's for the family members and friends of the addict,
and
yes.
They need as much help as the person involved in substance abuse?
They do. They get as wrapped up in the addiction as the addict is. I say addict sort of generically,
Sure.
and so they can get as crazy, as insane as the addict is without using. So they need a group of folks that kind of help keep them grounded, that they can meet with on a regular basis, help them learn boundary techniques. The biggest thing folks in Al-Anon learn how to do is how to say no.
And they have to say no to the person that's involved.
To the person that's involved, yes.
How about feeling of guilt or enabling, or the person that goes to Al-Anon, not involved with substance abuse,
Right.
but in family members, do they feel guilty and do they have to get by those things?
Incredibly guilty. Every family member blames themselves for the drug or alcohol
Yeah,
involvement that the
yeah.
addict is in. The kids all blame themselves. The spouse blames theirself. And Al-Anon really helps them work through that process of guilt that the addiction would have developed even if they hadn't been there.
A lot of success in people that go to Al-Anon meetings.
I think so. I think so. It's been around a long, long time.
Are there different groups? Should a person go to one or several?
I always recommend you go to several groups. I tell them that meetings are like people. They're all built the same, but they have different personalities. So I tell them to go to 7, 8, 10 different meetings in order to find the 1 or 2 where they feel like they fit. There's men's meetings, there are women's meetings, there's teenagers meetings, there are co-ed meetings, there are book study meetings, there are speakers, there's all kinds of different meetings. So,
Bill, you have great information. Thank you so much for coming to the Dr. Bob Show, teaching us about Al-Anon and how important it is for the people that have family members or friends involved in substance abuse.
Even if the addict doesn't get help himself, family still gets to go to Al-Anon.
Thanks again.
You're welcome. My pleasure.
We're talking with Dr. Sledge, board certified in addiction medicine. And we've been talking about alcohol, too much alcohol, and the problems that it causes with the family. It breaks them down socially, it breaks them down physically, it breaks them down financially. It's a devastating illness. Denial is part of that. The family can deny, the patient can deny. But once the family decides they need intervention, how do we do that?
And there are trained professionals that can assist the family. There's certainly tons of resources out there that can assist the family in preparing for an intervention.
What do they do?
Well, they have to prepare. They have to do their homework, and they have to be ready for any contingency, and they have to be ready to hold the boundary that this is what we need you to do, and if you don't agree to do that, then this is what the consequence will be.
So it can be very successful when you prepare for that. It's intervention successful 90% of the time, 98% of the time.
Intervention is successful when the person arrives at the door is able to engage in treatment.
Yeah.
And a person can come into treatment kicking and screaming and absolutely railing against the fact that they've been done this injustice and forced to be there, or they can come in, smiling and happy to be there. And outcomes don't vary that much. What matters is what happens after they get to the treatment process. If we can transform that external motivation from the family into internal motivation with that patient, then we've done our job.
The only time that I've seen intervention, and a couple of times, both times the intervention has been the person said, "Thank you so much, I've been waiting for somebody to help me." Is that a frequent response?
That is a frequent response. Often there is relief.
I would think that would be somebody that's ready to get treated and ready to get with it and ready to be well. So when a person comes in for treatment, is this going to be you're in a treatment unit, hospital, bed, community, or are you outpatient? What is it?
That's a good question, and the answer is we have to do an assessment and find out. And In the past, I think there was the idea that every alcoholic had to go to a residential treatment for 30 days, not 29 days, not 31 days, and that would be akin to putting every diabetic on the same dose of insulin. There has to be some individual assessment to determine the needs of that patient, and you try to match the severity of the disease of alcoholism to the intensity of treatment.
So what do you do if they go in residential, they go in-house, and it's going to be 2, 3, or 4 weeks? How do you help that patient?
The first priority is to maintain medical stability. We have to address any medical complications, liver disease, heart disease, brain disease that has developed as a result of the alcohol dependence. And we have to also manage withdrawal. We have to safely and humanely get that patient through the withdrawal process. And at that point, they're able to engage in the remainder of the treatment process, which would involve psychiatric stabilization. It would involve treating the family. Successful treatment has to involve the family. The family involvement is such a critical part of the treatment
What
process.
does the psychiatrist do?
The psychiatrist, just about every patient that walks through the door of a treatment center has some psychiatric symptoms. And our job is to determine whether those symptoms are the usual and expected part of early abstinence from alcohol or whether there's an underlying psychiatric disorder. And the psychiatrist can help us discern which is which.
So that evaluation can help you when the patient leaves the residential center, knowing how to best help that person.
Absolutely.
What other education, how do you educate the patient with the family?
Well, what we do at Cumberland Heights is conjoint therapy. We have the patients and the family in the same room and saying the things that they may not otherwise be able to say without the support of the treatment environment.
Is the family come in every day, or they live in the same community with the alcoholic in treatment? I would think the family's at home and the patient's in the hospital.
That's true, and we try to bring them together as best we can, and sometimes there's a week-long structured family care program where the family comes in all day for 5 days, and sometimes they may come in the evening once a week for education sessions, and we do an awful lot of phone sessions, and technology has greatly improved our ability to engage the family in the treatment process.
I've heard the following statements. Alcoholics are very cunning people, and if you're a family member, there's no real need to, it doesn't do any good to look for alcohol around or to do that. It's up to the patient to give them support. Where does that fit? Do you have to keep alcohol out of that house? Or
Well, I can tell you early on with abstinence, it sure is a good idea to have an alcohol-free environment for that patient to recover.
And I would think that would be essential. So the whole family has to grow together to get the patient well.
Absolutely.
How long is an ideal setting for most people, 90% of people, in-house? Is it 3 weeks, 4 weeks?
It again depends on the severity of the disease, and if somebody's got a stable home environment, they may be perfectly suited for outpatient treatment. If they've got a stable job and they've got a supportive family who's engaged in the process, outpatient may be perfectly acceptable. And if there is not a stable environment, if the patient doesn't have reasonable living skills, if they're in an environment that would be conducive to continuing the alcohol use, then we need to extend the course of residential treatment.
If somebody has had successful residential treatment and they graduate, do they go into, tell me, do they go into a halfway house? Do they go to AA meetings? Talk to me about how you give that person support after they leave your setting that's controlled.
Well, first off, we tell them that they have not graduated, that they're just beginning the process. And for a person with hypertension, for a person with diabetes, they don't do a 30-day treatment and they're cured. This is a chronic medical illness. It's not pneumonia. You don't get antibiotics and it's gone.
Once an alcoholic, always an alcoholic?
Once you have the disease of alcoholism, you must maintain recovery activities. You must continue to address the disease.
Is this a statement? I'm alcohol-free today. I'm going to work as hard as I can to be alcohol-free by tomorrow.
Absolutely.
You take one day at a time.
One day at a time.
And the family works with that.
And the family works with
Tell
that.
me about AA.
Alcoholics Anonymous is a supportive group that has been demonstrated to be very effective in the recovery process from alcoholism since the 1930s, and it's difficult today's age, with medications available that can be very useful adjuncts to the treatment of alcoholism, it's difficult to apply scientific rigor to studying Alcoholics Anonymous. So often it's discounted. You can't really do a double-blind study. You can't put a person in a room and it's not AA, and then somebody else that is going to AA. But AA has withstood the test of time, and it is a very effective modality for that person to continue to engage in the recovery process in a life-changing, lifelong.
Chappie, I've got too many questions to ask you. Let me have you give me a story or a generality when an alcoholic who has had a devastating problem becomes successful in his treatment. How is their life and their family life changed?
It's the most gratifying thing that I do is see people recover, and it's if all I could do was just take care of patients in withdrawal every day, it wouldn't be particularly gratifying. But seeing people come back that have regained their health, they have regained their peace of mind, they have regained their family and their social values, and they're gainfully employed, it's unbelievably gratifying.
That's such a wonderful statement that you just made. Chappie, we're out of time. I've had more fun on this show and learning more about that and understanding that alcoholism is a disease, and you've always got it, but when you recover, during that recovery, can change everything around you. Thank you for coming to the Dr. Bob Show.
Thanks for having me.
No, if you think alcohol is a problem for you and your family, intervention is just around the corner. Ask your doctor for help. He'll help you with intervention, or a local society that deals with alcoholism can also help you. Now you'll want to stay tuned. We're going to be talking about a heart stress test, why we need that, and polyps in the nose, how it can make life-threatening asthma. I want to thank Dr. Chapman Sledge for a wonderful discussion on a very important problem in our society, alcoholism. Now, questions from you, the viewer, that I think will be important to your health. Dr. Bob, tell me about a stress test for my heart. Well, people worry about their heart. They have vague chest pains. They have severe chest pain. The doctor worries about their heart. You've got high blood pressure. You've got diabetes. You've got elevated cholesterol. You've got medical problems. And we want to see how good the heart is. We get an electrocardiogram, measures the electrical activity of the heart. If it's sort of borderline, then we do a stress test. And what a stress test is we hook the patient up with wires that are electrocardiogram wires, put them on a treadmill, and begin to exercise and take the electrocardiogram while we are exercising. The treadmill will have an elevation, so we really do stress the heart. And there's a protocol, a guideline that says how fast we need to be going to get our heart rate up to stress the heart physically, and then we look at the electrocardiogram. Now, that will tell us if we've got coronary artery disease, sometimes, if we've got rhythm disturbances with exercise, sometimes. But to make that stress test even more sophisticated, we can add onto that some radioactive dye that we inject, where then after the stress test we lay down on a table, we can see the blood going around in the heart. And we can do an echocardiogram at that time and watch how the heart muscle is beating and see what the rate of the heart is and how good the heart is beating. So that cardiac stress test, wow, it gives your doctor a lot of information. If it's abnormal and if he feels right, then the next step would probably be a heart cath. So if your doctor orders a stress test, look forward to it. It's going to give you information on your heart that nothing else will. Question number 2, Dr. Bob, my doctor says I've got asthma and nasal polyps. Will the polyps lead to cancer? Well, it's a good part about polyps. Polyps is an overgrowth of tissue in the nose, and the polyps frequently cause people to have a nasal toad. They lose their sense of smell, and if they've got asthma, there's a condition called the Samter's triad, where nasal polyps, bronchial asthma, and aspirin or ibuprofen sensitivity, where aspirin or ibuprofen can cause severe life-threatening asthma. So if you've got nasal polyps and asthma, the doctor has to address the polyps. And sometimes, if we get the polyps better, then the asthma will get better. So what can we do to get the polyps better? Number one, prednisone, cortisone medication for a short period of time will get the polyps to go away. Sometimes they come back. So we follow that with cortisone sprays for the nose, and hopefully we can get the polyps to go away. There can be aspirin desensitization. Now, polyps, asthma, aspirin can make a life-threatening asthma attack. But we can desensitize with a protocol, aspirin, starting at a very low dose and building up stronger and stronger. Some people feel anybody with nasal polyps should have a trial of aspirin desensitization. It may be that the polyps will have to have surgery where we go up into the nose and we remove those polyps and part of the sinuses. It's a very important part of your health. If you've lost your sense of taste and smell and you've got a nasal toad and you're coughing and wheezing, talk to your doctor about getting a CT scan and taking care of those polyps. All the time that we have in this show. Remember, those 4 things, we've got to be doing them. Get on your tennis shoes and start exercising. It makes you feel so much better. You'll feel more vim and vigor. I hear the stories all the time. People start exercising, they feel better. Get 8 hours of sleep, you'll also feel better. Isn't it great when we get 7.5, 8 hours of sleep? We work better, we feel better, we don't get behind, we don't get irritable. People around us like us a little bit better. Eat properly. Eat more fruits and vegetables. You know what the good foods are, and cut down on that volume. But most of all, what I really want us to do is to have laughter in our life. You know, enjoy laughing, giggling with somebody you love, and the more you laugh, the healthier you'll be.